Nova Scotia is hoping cash incentives will keep nurses on the job. Premier Tim Houston announced a $10,000 bonus yesterday for overworked and burned out healthcare staff. And today, new legislation ahead of the provincial budget aimed at reducing the time doctors spend on administrative paperwork. It's just the latest incentive for healthcare workers in Atlantic Canada, where governments face an increasing shortage of nurses and doctors. Nova Scotia Premier Tim Houston joins me now. Premier, welcome back to the show.
Happy to be here. Thanks for having me.
The most recent data from Nova Scotia Health shows almost 14% of Nova Scotians don't have a family doctor. So how will this legislation introduced today help Nova Scotians get access to a doctor?
Yeah, so thanks very much. I mean, we're obviously concerned about that. The number of people unattached, it's a Nova Scotia issue, it's a national issue, but we're focused on access to care. So we're making sure we can open up channels to care through virtual care, through mobile clinics, through primary care clinics. We've done a lot of really innovative stuff here in the province. But when you get right down to it, we need more healthcare professionals, we need more doctors, we need more nurses. So we've been working closely with the colleges. We have a great relationship with them. They've done some innovative things too. But what the legislation will do is allow us to move very, very quickly in those cases where it's appropriate for an allied healthcare professional to have an expanded scope. It will allow us to move very quickly on credentialing professionals from other jurisdictions, other parts of the country or other parts of the world. So really what the legislation that's in today, that we tabled today, that we'll debate in the legislature the next couple of days, it's all about going faster and doing more to make sure that patients can access care. So we'll do our part as a government. Nova Scotians, I think, know that, but there's a lot of work to be done.
Over the weekend, the federal Conservatives, their leader Pierre Poilievre, rolled out a Blue Seal program for health professionals, promising to sign a deal with provinces that would make it easier for foreign-trained health professionals to get certified. Do you need that sort of effort at the federal level, or is this something the provinces are already working on themselves?
Well, we're going to work with anyone who wants to help, solve the issue. I mean, we can never lower the standard of care. We have to have a common sense path to credentialing and accepting credentials where it's appropriate. So, nationally, if we can work together, I'll work with any party who wants to help us solve the problem. So, as I say, as a province, we're doing what we can. We're really taking the lead. We're leading nationally on a lot of issues. Our Nurses College has been great. Our College of Physicians last week announced with the U.S. credentialing. So they're moving. We're moving as a government. But look, we'll work with any partner, any province, any federal party who wants to help make sure Canadians, Nova Scotians, can access care. We're right there with them. We're going to work with them. We want to work. We have to move quickly on this.
Okay, so yesterday you also announced some big incentives, financial incentives for nurses, up to $20,000 over the next 2 years for nurses who have worked in the system for a year or commit to come back to the province and work in the public system. What effect do you think this will have on your workforce when there is such a critical shortage of nurses?
Yeah, so we have 1,600 vacancies for nursing right now across the province, and so we know that nurses and doctors and healthcare professionals across the spectrum, but specifically nurses are working short-staffed a lot. It's been a rough couple of years. There's no question about that. So this was our way of saying thank you to them. I mean, thank you is good when you say it, but when you support it with other initiatives, like a cash payment, like some initiatives to help support them in their working environments, in their day-to-day on their shifts, it's really important. So this was our way of just saying, hey, we see you, we hear you, we know it's tough. We want to recognize that with some financial compensation. We're going to work to make the working conditions better and hire more people so you have the support you need. As a government, we'll be there to do that. But I think yesterday was just our way of saying, hey, look, it's been tough, and this is a little incentive on the government's part to recognize that toughness. But there's a lot of work to do, as I say. We can't continue to lose healthcare professionals. We need to support those that are in the system, and this was part of that.
Right, so that $10,000 thank you bonus, to coin a term, I mean, that helps maybe stop that 1,600 nursing shortage from going to 1,700 or going to 1,800. But with the cash incentives you're putting on the table, what's the target to get that down? I mean, how do you see this helping deal with that chronic shortage?
Well, it's to help a little bit with retention for sure, but we know, you can't recruit if you don't retain. So we have to make sure that there's a good work environment. So, but then now you get into the other initiatives like the bill that we tabled today, like the work that in this case, the Nurses College has done to recognize credentials from people from other countries, other parts of the country as well. So look, there's a lot of moving parts to this. It's going to take there's not one solution that fixes it all, but there's a number of solutions that actually actually build together to get us through this. And we're taking those steps. And of course, you take a few steps, and there's a little bit backwards sometimes, but you got to keep moving forward. And what I want the healthcare professionals to know that working here in Nova Scotia, we want you here, we need you here, we'll support you. And for those who want to move here and help us fix this healthcare system, we welcome them too, and we'll work on those credentialing to make sure it's a kind of a common sense, straightforward path.
Okay, well, your next big step is going to be your provincial budget, right, on Thursday. I suspect the new federal health money is going to be in there. Can you give us a sense of how far you'll go beyond that in terms of putting extra provincial money in? What will your priorities be for your budget on health?
Yeah, so thank you. So the legislature, our provincial legislature resumed today. Our budget will be tabled on Thursday. It will be a healthcare focused budget, no question. Go, do more and go faster. That's kind of my ask of the team and of the whole team we have here in the province. Do more, go faster. So we're investing in infrastructure, of course, with bills. We're investing in technology, our one patient, one record system. We've announced that. We're investing in human resources. We will invest in healthcare. We want to, the only two things that I'm focused on are fixing healthcare and paying for the fixing of healthcare. So we know we need to grow our economy as well, but fixing healthcare means making sure that Nova Scotians can have access to the care that they need. So there's a lot of innovative stuff happening. The healthcare system that was built 20 years ago, it's, it needs to change and adapt, and we're doing that. We're trying to lead the way with some innovations, but the budget will show that our commitment to fixing healthcare is as strong as it has ever been.
Okay, Premier Houston, thanks so much for the time.
Thanks for having me. Really appreciate it.